My name is Abby James, and in this video I'm going to be demonstrating induction, intubation, and dental prophylaxis on a canine. So for starts, I have all of my dental equipment ready to go once she's sedated. So here is all of my endotracheal tubing. This is her injection stuff, and I have made sure that this is the right dosage for the right pet. So we're going to start by going ahead and giving her her injection. It's all right. It's okay. Okay. Go ahead and loosen her tourniquet. I'm going to make sure I'm still in her vessel. There we are. Okay. Okay, and I'm going to go ahead and let her get relaxed. All right, and while that's taking effect, I'm going to go ahead and measure my endotracheal tube, or wrong way, to her, just to make sure it's a good fit. Probably will go a size down. That looks about right. Okay. Okay, so I'm just going to position my light to where I can see straight through. And I'm also monitoring her for any apnea, cyanosis, any sign that she's kind of struggling. Okay, so I'm going to go ahead and tie that down. And I'm listening just to make sure that that tube is in the right spot. Okay. Okay, so let's move all this stuff out of the way. Turn around. Inflate her cuff. And turn her ISO on. So we'll get her nails trimmed, her vaccines done, and get her set up on monitor, and we'll come back when we're actually doing the dental. Okay, for this next portion, I'm just going to do a quick intraoral exam on her, and I'm just going to examine like her occlusion, her gingival tissue, and all of her teeth. it appears she has a little bit of a fracture on this molar. Her gingival tissue appears to be okay, and her occlusion looks okay as well. So I'm gonna go ahead and put on my mask. And my glasses. Okay, I went ahead and put my mask and my glasses on. So we're just gonna go ahead. And I'm just going to position her with her head downturned. These things over here. So I'm just going to go ahead and use our ultrasonic scaler. It appears that this tooth here is loose and needs to come out, so I will go ahead and make a note of that on her dental notes so the doctor can kind of examine that. So that is okay, and I'm also going to go ahead and make note of like her occlusion status, like her gingival tissue, sulcus tissue, while I'm already here. Set that back down. Okay, and actually before I go ahead and scale, I'm going to use our little periodontal probe here, and I'm going to measure about how far deep it goes. Okay. I'm just gonna go ahead and check out these teeth as well. So that looks like it is in good condition.
Yeah, I was just thinking, I mean, I don't need it, I'm just thinking of it.
This tooth as well. That looks like it is about a 2. That tooth as well. Okay. And we will go ahead and do the bottom tooth here. So we'll pull her lip back. See a 2, a 1, 1, 1. You can stop it real quick if you need to. Okay, this tooth is going to be a 2, a 2, 2, and 2. Okay, so everything looks like it's in good shape, in good condition, other than the second molar back here. I can see a little bit of infection coming out from under the gum. So I will go ahead and scale that tooth and get it clean for the veterinarian to inspect it. So I'm just going to go ahead and clean underneath her gingival tissue. As you can see, she has a little bit of staining under here, as well as the enamel appears to have been cracked or chipped off of her tooth there. So again, I'm just going to go ahead and make a note of that. Okay, and I'm just going to kind of demonstrate hand scaling. So, just going to remove all of that tartar. And I'm being very gentle to just ensure that I'm not going to abrade the surface and the enamel on her tooth.
Little schnauzer girl can come on in. I'm just kind of cleaning this back of this tooth here.
that tooth is done. So we'll move over to this one.
Yes, I need to go look at your picture. Will you just watch her and let me know out there so I remember where she put it? Or do you want me to go grab pictures or? I'm looking.
Okay, and we're just gonna hand scale this last tooth.
I forgot my.
And I'm just gonna go under and make sure that gum line is clear. Okay, and that is how you hand scale. So I'm just gonna go back and polish these teeth. Our polisher is actually not working momentarily, and it is sent, or we have another one supposed to be coming in. I can show you what that looks like once we get the procedure done. But for today, I am just going to be using the tip to try to polish her teeth. Her owner was made aware of this prior to the procedure. So I'm just gonna put it.
And with her, I need to see the rest of her record.
I'm gonna go ahead and rinse that off. I'm gonna pull her head a little bit more forward. Okay, so I'm gonna go ahead and start on the bottom quadrant and go ahead and clean these inside teeth here and the inside of these, and we'll flip her over. Okay, and that is another molar that seems to be loose, so I'm going to go ahead and just a few seconds to make a note of that on her dental file. Making sure everything looks clean and okay. These molars back here, as a matter of fact, both of them and this premolar, these all three are loose, and I'll kind of make a note of that in her file for when the doctor gets here. They have quite a bit of staining on them that I wasn't able to remove. Okay, so I'm just gonna go back over these teeth and just make sure I got everything, and I made sure that everything under the gum tissue is good and clean. And that appears to need pulling as well. Okay. So I'm gonna go ahead and flip her over. We're gonna clean the other side and just make sure everything looks good with that. Okay, so we're now at the other side. As you can see, these teeth back here are in pretty rough shape. So I'm gonna clean them up the best I can. So that way when the doctor comes and kind of examines her mouth. From this side, I can see that her gingival tissue is all inflamed and angry, and she's kind of showing that she has periodontal disease. So I'm going to go ahead and make a note of that in her dental file as well as soon as we get this side polished. And she appears to have a little bit of ulceration, and so yeah, I'm going to do the best I can to try to clean this up and make it more visible, I guess. And I forgot to mention, she does have a couple gauze pads in the back of her throat. That way, it prevents anything from going down her esophagus or any kind of water or debris. And those are removed after surgery, and they're changed out occasionally. And I'm also kind of scaling the teeth, and I'll take my foot off of that pedal. That way it prevents the tip from getting too hot and like damaging her tooth or burning her gum. And all that you see right there, that is a lot of hair and infection kind of hanging out there. Oh. Okay, so I'm not quite sure I'm going to be able to get this guy all the way clean. It looks like it's already trying to fall out on its own. So I'm going to move on here. Adjust my way. And also, I forgot to mention, once we turned her over, I went ahead and checked her gums and her tooth pockets with the periodontal probe. Everything checked out okay, except for these 3 guys here. They had very deep pockets, and it appeared that they had a little bit of infection down in those pockets. So, and I'm going to make note of that as well. Okay, it appears that this tooth has a extensive bit of staining as well. Okay, and this one is very loose and appears to be infected, kind of like the other guys up there, so I'm going to try to remove some of that. also, when I'm cleaning these teeth, I'm making sure to get behind the teeth as well, in areas that kind of have a little more visibility. Okay, and as you can see, there is still an extensive amount of staining back here. The teeth were scaled pretty well. These guys are also the ones that needed to be examined, and that were kind of showing a little infection here. So we're gonna go ahead and polish everything again. Okay, so I'm just gonna start by polishing the healthier teeth. Okay, and I am not going to polish the teeth that are problematic or infected. I'd already put the polish on this tooth here before I had remembered. Just go in and so I'm just going to go ahead and rinse all of the polish out of her mouth. Okay, and I'm going to go ahead and dry her mouth out, and I'm going to be making a note of the condition of these teeth here and her occlusion and her gingival status. Okay, now Dixie's dental is done. I went ahead and filled in all of her notes that I was going to write down after her scaling. She ended up having 6 extractions, including the really nasty infected teeth. So, and I forgot to previously mention, we do not have dental radiograph equipment here at our clinic. So her radiographs were referred over from another clinic.